We call this dire consequences. We're very concerned about the proposed coal phase out, and we think we have good reason. We have some new terrifying claims from the Pembina Institute and their associates. They've issued a new report called Breathing in the Benefits, and they say that we live in a province where nearly as many people are killed from coal power emissions as there are homicides every year. That's from Dr. Vipond. And doctors agree that coal power is a health hazard from start to finish, and they claim that Alberta could spare as many as 600 lives and save $3 billion in associated costs. So we're going to have a look and see if that's true. So it's our view that the main problem with the Pembina report is that faulty computer simulations lead to illogical conclusions, because all of the Pembina's numbers are based on simulations. They're not based on actual patient records. And that's a really important point. So Pembina is saying, logic states that if reducing coal-fired electricity reduces health impacts, then conversely, the burning of coal for electric energy must cause health impacts. Well, is that true? And if so, to what extent? You know, perhaps it is true. We do remember London in the 50s. I mean, that was a very long time ago, but, you know, it was pretty smoggy then. So, a few years ago, when the first Pembina Institute report came out, we talked with economist Dr. Ross McKittrick. And Dr. McKittrick had this to say about that report, A Costly Diagnosis. These are modeling studies. They don't track actual individuals. Before using such model predictions, you need to ask if the numbers make sense. So in Dire Consequences, the report we'll be reviewing, we looked at actual patient records around the world, in the UK and in Alberta, related to the effects of coal, of heat or eat poverty due to power price rises, and we assessed Pembina's coal health claims against actual Alberta Health Services statistics. So what is the most vital driver of modern medicine? This is from our previous report, Burning Questions, and in it, there's a peer-reviewed study that electricity was recognized by the UK Department of Health as the most vital of all infrastructure services, because without it, most other services will not function. And you can imagine a hospital, when it goes to black, it's a big problem. I mean, people on heart pumps, people are intubated, surgeries are in process. This is why hospitals all have big backup facilities. They have diesel generators. But those are not meant for long-term or for frequent use. So power is very important. So we think we should learn from the UK. They went from capacity to catastrophe, literally in a space of about 4 years. If you look at the graph, you can see the peaked point on the graph is about 2012. And at that point, they had lots of spare power because they had lots of coal. And now you can see in 2014, 2015, that little gray block, they're actually having to supplement their power system with diesel generators. They have individual diesel generators that they've incentivized to the system. They are also asking industry to power back at peak times. And when that happens, industry gets paid subsidies as, you know, a compensation for powering back during peak times. But in fact, they're actually very close to blackout a lot of the time. And during 2013, there was a terrible winter storm, sort of a spring-winter storm. In the nick of time, these LNG tankers arrived from Qatar. And I can't imagine how much money that cost them, but it cost them a fortune. Thousands of elderly people died in that period due to heat or eat poverty. Now that sounds ridiculous that that could happen in Alberta. But let's look and see. First of all, let's talk about the air quality in Alberta. You can see on the map in the upper right-hand corner, the lighter part of the map shows where all the coal reserves are in Canada. So there's some down in the Maritimes, there's some way up in the north, and there's a whole bunch in Western Canada and BC and the Yukon. So this is why we use coal. We're sitting on huge seams of coal that will last for hundreds of years, very high quality coal. The modern coal use in Alberta is well monitored, and the emissions are reduced through scrubbers or through the use of supercritical modern plants. Keep Hills 3, at the time it was built, was considered to be the finest top quality plant in North America, the most advanced. Alberta's coal is low sulfur, it's high quality and less polluting, very abundant, very affordable, and we own it because of the mineral rights legislation in Alberta. So we're self-sufficient, and that's a very important point when you're talking about power. You don't want to be relying on somebody else who can up your rates when you least expect it or cut you off just because they don't like you having a pipeline through their place or any other reason. So since the growth of coal-powered electricity in Alberta, we can see in the graph at the bottom that longevity has gone from about 50 years in 1931 up to into the 80s and 90s. So it doesn't look to me like people are suffering a lot from coal. It looks like they're benefiting. And Canada was deemed to have the third best air quality in the world in 2011. This was by the World Health Organization. Edmonton and Calgary are in the top 10 of that study. So we have lots of coal, it's affordable and reliable, and that's why we use it. So let's compare some major cities. Edmonton and Calgary are well within the WHO standards. You can see that very popular places like Hong Kong, Paris, Rome, London, Barcelona, Denver, where millions of people live, they live in a cloud of smog. But in Alberta, in Canada, and in Calgary and Edmonton, our air is well below the serious standards of the WHO. This is related to nitrogen dioxide and the other one to fine particulate matter. And of course there are other measurements as well. I didn't include them here. You can see them in our report, but I'm not trying to hide anything. The other ones also show that the air quality is quite good. So is it coal or is it cold that kills? Well, when you look at the cost of heating, when it goes up, the amount of food purchase goes down. And you can see in this graph, when the cost of heating goes up, the black bar below is when the food goes down. So this creates heat or eat poverty. It's also called energy poverty. And for children, this leads to long-term detrimental health effects. This creates more health complications for those with weak immune systems or people who are vulnerable. And there's a significant rise in premature deaths in the elderly. People suffer physically, emotionally, and mentally. Cold kills, mortality, in a long-term study of some 74 million patients. Their deaths from 1985 to 2012 in 384 locations in 13 countries, it was found that cold temperatures are responsible for 17 times as many deaths as hot temperatures. So I'm not sure that we should be afraid of global warming. Maybe we should be more afraid of global cooling. Even though Alberta uses natural gas for most home heating, if power prices go up, the result of heat or eat poverty will be about the same. Cabin fever. We all know this, we're Canadians. But when people are on a tight budget, they often shutter their house, they close off a couple of rooms and try and lead a smaller life. So when they have chronic thermal discomfort, they're cold and shivery all day, they worry about energy bills, concerned about falling into debt. When you look at what's happening in Ontario these days, that's a very serious concern. People are getting bills for hundreds of dollars a month, way over what they anticipated, and there's no recourse. There's concern that cold is damaging people's physical health, especially for children. Spatial shrink or cabin fever, living in only 1 or 2 rooms that can be affordably heated, and a stigma in the community. You don't want to invite people over to, huddle around a candle in your living room. Plus, damage to your possessions. They may be affected by damp or mold. and that sense of helplessness. I'm sure that's what a lot of people in Ontario are feeling, the absence of any solution or control over the problem. How do you fix that? So we looked at a study in the UK, the Royal College of Nursing reports that actually it costs more when people are suffering from the impacts of cold. So they found that there were 24,000 excess winter deaths. They found there was a variety of respiratory illnesses, increased risk of heart attack and stroke, low weight gain in infants, and lots of emotional and mental health problems because of all these stressors, and poor diet and nutrition because of a heat-or-eat poverty situation. Lots of falls and accidents. You know, when you're numb and you're cold, it's not so easy to maneuver, especially if a person's elderly. So there's a worsening of existing health conditions. And according to the UK Medical Office, they spend about 850 million pounds a year treating illnesses caused by living in cold homes. So that doesn't sound like there will be a saving if we phase out coal. Job loss, loss of economic competitiveness. In Alberta, about 75% of the power is used by industry. So here's an excerpt from Hasselblad report. Germany's massive push into renewable energy has a dark side. As green policies drive up the cost of power, entire industries are shrinking. Like hundreds of people are out of work. We have a policy that is exporting jobs, exporting investment, exporting manufacturing, and increasing CO2 emissions at the same time. Mr. Commissioner, if that is not madness, what is? And that was Roger Helmer, a UK member of the European Parliament speaking to the EU. That's part of what caused Brexit. And the problem is, even if promised rebates, they don't keep up. So Environment Minister Phillips has boldly claimed that renewables lower the cost of power for consumers, but we don't find this in any of our research. The poor cannot afford new energy-efficient appliances or new cars with lower mileage, and rebates after the fact are far too late. And that's what we're seeing again in Ontario, where people are being told, oh, well, we'll cut you a check for some money to help you out. But by that time, people are really on their knees. So do the coal health claims hold up in Alberta? This is a graph from 2005, published in 2006. It shows that COPD, chronic obstructive pulmonary disorder, which is one of the conditions that Pembina cites as being caused by coal. It's the dark blue line in there. It's actually happening to people who are well into their 80s. So that's not being caused by coal today. And most of these deaths are happening much later in life, when people have lived through a time when they were smoking, when there were few environmental controls. So we don't see a huge incidence of any of the health issues on this graph in the younger area. Actually, injury is the largest category in younger people. And is coal the largest emitter of PM 2.5? That's fine particulate matter that's less than 2.5 microns. So you can see in the graph that the comparative chart shows a coal plant beside a fireplace. And the fireplace emissions are double that of coal. This is from 2011. When you look at the second third of that graph, you can barely see coal plants compared to residential fireplaces. Then agriculture is the little green line. Then you see construction dust is the next largest, and the last one is road dust. And then we go down one more and we can see that actually, compared to all of those, the worst is wildfires. Wildfires put out 1,000 times the PM 2.5 of coal plants in 2011. So those numbers will vary, of course, from year to year, but not significantly. And how about asthma? Well, you can see in this graph from Alberta Health Services that asthma has been declining in all categories for the past decade. And in the other side, in the small graph, the print is quite tiny, but you can see it in the report. that of 22 deaths reported due to asthma, 2 were in the ages of 5 to 9. Now, the anti-coal people have been using a picture of a little girl with a puffer, with an asthma puffer, inhaler, as evidence that, you know, this is dramatically affecting our youth, but the statistics don't show that. In fact, there are 11 people who died of asthma complications aged 75 to 90, and 1 non-resident. So that evidence does not seem to support their case either. Aside from dust, we have Mother Nature. This is these are colorful statistics from aerobiology research labs. Aerobiology is in Ottawa. They run all the pollen monitoring across Canada. So we ordered their material for March to October 2011 for our previous report, because that was a reporting period we were working in. So I just show it here as an example. You can see that from March to October in 2011, there's a huge variation of different kinds of pollens and spores throughout the year. And if you look at the bottom one to the right-hand side, you can see in October there's this blossom, this proliferation of a very toxic kind of spore that proliferates a lot around Edmonton. And why around Edmonton? Well, Edmonton has the boreal forest nearby. They have a lot of agriculture in the area. They have river valleys, sloughs, all kinds of places where molds and spores and pollens can manifest, and they often get locked in with damp air. So you can imagine that in Edmonton that would be a really critical factor for asthma trigger. So now we looked at a peer-reviewed study of Alberta patient records, and they do not support the Pembina claims against coal. This study from 2015 looked at 93,146 patients for their 199,991 visits to emergency departments. So we found that in Edmonton, the crude rates were 7.9 per thousand. They were 6.5 per thousand in Calgary, and in non-major urban areas, they were 15.4 per thousand. So that means that asthma emergency department visits were double in the non-municipal areas, in the non-urban municipal areas. And we come to this map, where we see on this bubble map that has tracked all of the data from 2015 from the Alberta Primary Healthcare Community Profiles. You can see that around the area of Edmonton, where the most coal plants are, the asthma emergency rates are very low. And actually the highest rate is down in the Pincher Creek area, which is Pincher Creek, Claresholm, that whole area, which is very ironic because that's where most of the wind farms are. So now we don't know that there's a correlation there, but it is pretty ironic. And you can see also up in the north there's a couple of red dots there. You know, this may be related to spores again. It may be related to residential fireplaces, because they kick out a lot of different chemicals, and they mix in the air and become other secondary pollutants. And again, Alberta Health Services statistics do not support the claims against coal use regarding respiratory ER rates. So another bubble map, another look at the whole province. And you can see again, the area of Edmonton is green, looks pretty good, you know, at very low rates. But places like up in the north there's, wow, lots of respiratory emergency visits. But if it were coal plants, you would expect to see bright red in Edmonton. That's not there, not even gold. So let's look at why coal is a critical factor in Alberta. On Christmas Day, I took this screenshot on Christmas Day. It was around 3 in the afternoon. What was lighting your house, your tree, and cooking your turkey if you have an electric stove? It was coal. And so TNG means a total net generated. You can see that coal was putting out 4,875 megawatts. There was some wind that day, but not very much. But if you did some simple math and you took away the coal, you can see that we would not have had enough power for the province. And you should be looking at the total net generation column, because what's deceptive in the wind column there, we do have a maximum capacity of 1,463 megawatts of wind. But if you look in the dispatched contingency reserve column on the far right, you'll see a 0. And that's because you can never tell the wind to turn on. You have to wait for Mother Nature. So it is calculated as a 0 contribution to the overall power of Alberta. So without coal, we would have been in big trouble. And wind and solar cannot replace coal. We often hear the ministers in the province saying, well, we're going to replace coal with 30% wind and solar. Well, it won't replace coal. It's only a supplementary source of power. Coal plants provide a slow, steady, low-cost power generation. They're very reliable, and the power price becomes predictable. That's really important for long-term planning for everyone, especially for industry. So you can think of a coal plant like a slow cooker. And wind and solar are intermittent and unreliable, so you can't count on them. Wind and solar need a natural gas plant to back them up 100% of the time. And they need natural gas peaking plants to ramp up the power when the wind dies off or when the clouds come in. So these are the new plants that will have to be built. Burning natural gas to back up wind and solar actually creates more CO2 emissions. And this was a finding of the Ontario engineers. So, and the other problem is natural gas is a market commodity. Like if you look at the figures for coal costs over the past 50 years, you'll find this very, very slow, barely incremental rise. It's been a very, very stable price. But natural gas is not that way. So you can see here from this graph that even in very recent years, natural gas prices have skyrocketed. So at this point in time, there's a flood of natural gas on the market. Prices are quite low. But just imagine we do get the LNG terminal on the coast. Just imagine more natural gas plants are built in the States, because that's the trend down there as well. And we build more natural gas plants, and all of a sudden, prices could go anywhere. So Alberta is powered by coal. If you look at the table on the right, you'll see that coal supplied 55% of our power in 2014. And 35% came from natural gas. So 90% came from fossil fuels. And the one on the left shows you that in 2015, 64% of our power came from coal. About 70% or more of our base load power comes from coal. So base load is the slow, stable power that you need to cover all the needs of the province most of the time. So for instance, you look across the street and you can see at this time of day all these lights are on. So at the Alberta Electric System Operator, they've tracked use of power, and they've got a pretty good idea that at 7 o'clock at night in the middle of October, people will need this much power. So most of it they try and draw from the cheapest source, and that would be coal, right? And the coal people even bid in at a very low price just to make sure that they can get a stake in the market. But in the Alberta Climate Plan, key elements are to phase out coal power plants by 2030. And maybe you do know, maybe you don't know, but there was already a federal plan in place to phase out coal. And the idea was to take the oldest plants offline by 2030 with no cost to us. And then there'd be about 6 of them that are the more modern plants and the supercritical plants that would keep operating up to about 2050, 2060, to the end of their useful life. This is how investors put money into Alberta. This was their understanding that they were investing in a coal plant that would run for the next 40, 50, 60 years. So the Alberta government has turned that upside down by saying, no, by 2030, no more coal plants, period. So this is a big shock to investors. It's not common that this happens. And also when you look at the recent news about the power purchase agreements that were turned back to the balancing pool, then you can see that that little clause that was written in supposedly at the last minute was actually very important, because the government is doing exactly what that clause was supposed to prevent. And the similar thing happened with the phase out of coal. You know, those people will have to be paid compensation, and it will be billions of dollars. So the unintended consequences of this, and this is where we get to the critical point about potential blackout. We're not only phasing out coal plants, but we're also bringing in a carbon tax. So the older coal plants that would ordinarily have gone offline in 2030 because of federal legislation, now they're going to be hit with a carbon tax. That will make those old plants less profitable immediately. And over a short period of time, the operators will probably close them down. I can't say that they will, but people want to make money, and if you're paying a carbon tax on a plant that's performing less than standard, you'd probably close it. So as these are closed down, they'll be closed down earlier than 2030. Now it takes about 7 years at least to build a new natural gas plant. There's a whole process involved in getting the land approved, environmental assessment, ordering the materials, getting the design made. We don't really have a very big window of opportunity right now, especially because investors are pretty gun shy of Alberta. So you're not going to have a bunch of people lining up like, oh, I'm going to build a natural gas plant, can't wait, because they don't know what the compensation is going to be to coal. And the environmentalists are already beating the drum to try and shut down natural gas plants, if you can believe it. So this is where there's a serious risk. And so another thing is that for bringing in wind and solar, which could supply some energy, even though intermittently, it's estimated that it would cost $900 million a year. That would be at $35 per megawatt hour for subsidy. So $900 million a year in subsidies just to support wind and solar. This is on top of all the other costs. And we have no clarity on whether Site C Dam will be built. That could supply us with some power from hydro, from BC. But the problem again with that is there wouldn't be enough power from Site C Dam to back up all the wind that they're trying to build in Alberta, so we still have to build new gas plants. And do we really want to put BC in charge of our power switch when they won't even build a pipeline? So, lots of things to think about there. So the costs of coal phase out are, in our view, exorbitant and unnecessary. It's going to be at least $22 billion, about more than $11 billion to build the replacement plants. So the Shepard plant in Calgary here, the new Shepard Energy Center, is an 800 megawatt plant. It cost $1.4 billion. So we'd have to build 8 of those or similar. So that's more than $11 billion. Then it'd be more than $11 billion to compensate the coal industry for their stranded assets, that being their nice new coal plants. And then we'll still have 7,000 coal industry workers out of work. We'll have 30 communities that are destroyed. And they will all have to be supported in some way. That will be millions of dollars. And now the Alberta government is also suing itself for $2 billion over the power purchase agreements. So, and how do we know that costs go up? Like the minister has said, we know that renewables bring the cost down. Well, we looked around the world and we said, what happens when you put renewables on the grid? And we found in Germany and in France, prices went up for industry. The US prices stayed pretty flat. China is flat. China is building coal plants. In the center, you can see this is from Lessons Learned, which is a report from FinAdvice, a merger and takeover advisory group in Switzerland. And they did an assessment. They found that in Germany and Denmark, which have the most renewables, the prices are the highest. And on the far side, you see that from 2005, when the climate plan was implemented in the EU, and it's a very similar plan to ours. That in the intervening 8 years, power prices went up 37% over US prices. Like, that's a huge rise. And that sent millions of people into heat or eat poverty. And so when we look at the Alberta Climate Plan and carbon tax, and Ken has some handouts here and some reports on that, we find that after all these costs and turning our power grid upside down, what will we be achieving to stop global warming that has already stopped and stop climate change that changes naturally? Well, we will be able to claim that we have reduced global temperatures by 0.00007 by 2030. So that's insignificant and undetectable. We know that climate does change cyclically. We cannot predict what it will be. There are some indicators, but we can't predict if it will be warmer or colder specifically. But you can see here that there is quite a rhythmic kind of warming and cooling that goes on. And in our view, of course, this is related to many factors, mostly the sun, which affects all of Earth's climate systems way more than humans ever will, and those systems affect each other. And then of course there's the internal aspects of the Earth. You know, we're basically like a little orange peel wrapped lightly around a ball of molten lava. So the Earth is still moving, like even though the tectonic plates moved a long time ago and we are, oh, we're not Pangea anymore, they're still moving. We still have earthquakes, volcanoes, so these also affect climate. As Dr. Harper says, we live on an active planet. And so we say that the sun is the main direct and indirect driver of climate change. That doesn't mean that humans have no effect. Humans do affect climate. We think it's more regionally. There are things that people do like deforestation in Indonesia where they're burning off forests, water diversion, land use. So we do have some effect, but we can't actually stop climate change or stop global warming. We can adapt to the changes and we can mitigate pollution. For instance, one of the things you'll read in our report is that Canada has greatly reduced the amount of mercury emissions from industry. But it doesn't help us very much because most of the mercury in Alberta comes from Asia. So these are the kind of pollutants that we think people should be paying attention to and reducing, just as we have done in Canada and in Alberta. And we hope that you will speak up because we think we have presented evidence that shows that the case against coal is not supported by the evidence, and the carbon tax and such like are not going to benefit the world. You can't tax the world into stopping climate change. So we've got lots of material on our website, our blog, our Facebook page, our Twitter debate. So please join in. I thank you very much and welcome any questions.